kind of a lung disease where there is acute shortage of oxygen supply into the body because of reduced oxygen absorption from the lung cells. So that is called acute respiratory distress syndrome. The causes may be many. There are multifactorial causes. As and when the distress syndrome happens, we have to find out the cause and treat the cause accordingly.
Uh, Actually, recent COVID pandemic, we had lot of ARDS because of the COVID-19 virus. They become breathless, they will be put on ventilator, CT, bilateral laziness, ARDS. So if you give time, sometimes lung will recover. Then you can take out the ventilator, they will be all right. But some patients, it will deteriorate in spite of putting them on ventilator. So what we have done is to put them on ECMO. ECMO will take care of the lung function and we will wait for the lung to recover. We will give rest to the lung, and we had a very high success rate. We would have done around more than 200 ECMOs for these COVID-19 ARDS, and around 40 to 50% of the patients survived. And some patients, the lungs did not recover even after 3 months of ECMO, because ECMO is only temporary support. Then we did lung transplant. So 19 such lung transplants we have done. As Dr. Prashant pointed out, the first lung transplant for COVID-19 in India was done by us. And at that time, only 2 lung transplants were done in the whole of world. Ours is third heart transplant for a COVID-19 ARDS. So ARDS, ventilation, next ECMO, next lung transplant, all those things are possible. That depends upon the cause. Mechanical ventilation is for respiratory problem. But if there is any cardiac problem like MI, heart attack, they can have respiratory problem also. That time we will put them on ventilation. It is ventilator only for supporting the respiratory system. Then we have to take care of the heart problems. If it is heart attack, angiogram ಮಾಡಿ, if there is any block, we will have to clear the block by angioplasty. If angioplasty cannot be done, you may have to go for bypass surgery. So once the heart is okay, the lung also recovers, then you can take out the ventilator.